once again, I think that I'm one of the top tier lecturer in Atlas and then CDM in Asia. So let me start this. Yeah, you need to. This is a tables of CDM. So first of all, you need to be familiar with this. The person here, the person means patients. Person is patients. And vision occurrence is that outpatient vision or inpatient vision it means. And then condition in the CDM condition is disease. So if you want a disease diagnosis or you can find it in the condition occurrence table. Drug exposure, procedure occurrence, device exposure, measurements as kind of laboratory findings such as hemoglobin level or the level of the nitrate sodiums. And observation, you don't you're gonna hardly use this table in your study. And there are very many tables for vocabulary. In CDM, the ICD code, like some code like ICD code, we call it concept. So one single ICD code mapped to concept in CDM, which will be standardized concept. So all you need to know is that there is a concept as a ICD code or procedure code or medication code. The principle of CDM is patient-centric. Vocabulary and data models are blended, domain-oriented, and accumulated data from various sources, preserve data provenance, extensible and evolving. So it's changing, it's evolving, it's not static data model. And this is not dependent on your data platform such as SQL. So there are key tables. And the vocabulary itself is very important in Odyssey. So I recommend you to go to the Athena, which is a vocabulary website for Odyssey. So you can find like this is okay. Mirror my screen. This is the web page of Athena. Let me just replicate mirror my screen.
Trying to zoom in, Jack?
I'm fine.
You good?
I think. Well, I need to just make this mirror the screen. So this is the Athena, and if you type like myocardial infarction, yeah, let me start with heart failure. If you type heart failure, then there are a bunch of concepts with the same name of heart failure. But once again, our domain would be the condition as a diagnosis. So you can filter only the diagnosis from the domain. And in Amoxidium, there are standard concept and versus non-standard concept. When you conduct a study, you need to stick to the standard concept. So we can filter on these standard concepts for here. So even though it's very vast and large vocabulary system, but you will have the heart failure, only one heart failure in the condition domain with the name of the heart failure itself. If you click it, then it has there are very many concepts related with this heart failure. So this vocabulary ID, it comes from SNM SCT, which is an international standard vocabulary. And if you want to see the corresponding ICD code to SNMAT, for this, you can find the standard to non-standard map. Here, this is ICD code in Korea, heart failure, ICD code heart failure. And you can see there's maps. There should be maps. And this is ICD code that I-50. It is kind of corresponding ICD code and then to the heart failure of standard concept as a standard concept in CDM. And there are many sub concepts of this heart failure. So it has very complex relationships with other concepts. So but if you use it very wisely, then it makes you much comfortable, much easier to conduct a study. Let me show you later. And now, for the first time, we are learning about making cohorts, which is a building block in autism. There are many, so if you want to conduct a characterization study, as Danny showed you, then you can use the only 30 cohorts. And if you want to conduct a population level effect estimation, which I show you, which was like if you want to compare the Ticagrelor versus Clopidogrel for certain outcomes, then we need target cohorts, we need computer cohorts, and we need outcome cohorts. So target would be the patient using Ticagrelor, computer would the Clopidogrel cohort, and third outcome can be acute myocardial infarction, stroke, or bleeding events. If you combine the three cohorts, then you can do the population level effect estimation, or you can compare the outcome rates between target and comparator. If you use only target and outcomes, then you can calculate the incidence among the Ticagrelor group and how many people will have acute myocardial infarction or the bleeding events. That's the kind of the incidence paper. If you only have the Ticagrelor group and then when you have the myocardial infarction group, then it will be characterized in the study. You can characterize that the ages, mean age, or the distribution of age among these patients, among patients with Ticagrelor or among patients with acute myocardial infarction. If you want to conduct machine learning, if you want to build machine learning model, and you need target and outcomes as well. You don't need comparator for machine learning. You can you can define the target, and then you can set the outcomes that you want to predict something. It's all built in the atlas. We are learning today, but I'm going to focus on the population level effect estimation, which is comparative effect estimation as well. So there are numerous definitions of cohorts in the world, but in Odyssey study, the cohort is a set of persons who satisfy one or more inclusion criteria for a duration of time. So one thing you have to make sure that there is a duration of time to define cohorts. So it's not just the inclusion or exclusion criteria, and there is no exclusion criteria. There are only inclusion criteria here. So one person may belong to multiple cohorts. One person may belong to the same cohorts at multiple different time periods, but one person may not belong to the same cohort multiple times during the same period of time. One cohort may have 0 or more members, but one person cannot belong to the same cohorts during the overlapped time period. It can belong to the same course during the at the multiple different time period, not overlap time period. And when you define the target and outcome course, the initial events is the most important thing, including criteria and cohort exit. You should consider the two different things. together. Once again, the course in Odyssey should have start date and end date. So not just the inclusion criteria. You need to define the start and end date as well. There is a very free version of Atlas, which is very slow. So I just deployed the new Atlas instances. You can do it by yourself by using Google Cloud. So if you just Google the such as Atlas GCP, then there is some blog describing how you can deploy the Atlas and GCP. So if you have Google account, and then you can just start to deploy your own Atlas. It was changed. Anyway, you can just easily deploy your own Atlas instance if you need, but it costs you. So it charges you about the machine about the virtual machine in Google Cloud platform. So that's why I just deployed these 5 instances for you in this tutorial. And course, once again, there is initial target course, and then you will have some inclusion criteria, and then you will lose some of the patients because of your inclusion criteria. Finally, during at your analysis, there you lose some of the patients as well for because of your definition of analysis. And there is 4 steps to define the course, like initial events. Initial events is the most important because it defines your index dates of cohorts. So when it starts. After defining initial events, you can add more criteria, inclusion criteria, as initial events, inclusion criteria, or additional qualifying inclusion criteria. These 2 are not so different. So you can use initial event criteria, or you can use additional qualifying inclusion criteria for your inclusion criteria. And you may want to ask why there is no exclusion criteria as well, and let me show you later. And finally, once again, there should be exit. So whenever you define the course, you have to think about the exit or the end of the course. So we are gonna duplicate this, and then the package is fully. There is this is the package for the original paper. But for this study, I made a very simplified package for this tutorial, which is unloaded to Odyssey Korea. But if you make Odyssey Japan, then I can unload this to the Odyssey Japan as well. In the Ticagrelor versus Clopidogrel package, in the inst folder, in the course folder, there are definitions of this course. So let's make a course together. Once again, this is a study design of this study. I set the index event as a PCI, the first 15 years coronary intervention. Then the patients should use Ticagrelor or Clopidogrel during the 7 days before the PCI. Then my exclusion was, and then they need to have the diagnosis of the acute coronary syndrome, and I excluded those with previous history of stroke or gastrointestinal bleeding, and if they use Prospera or opposing drugs within previous 30 days, they are excluded as well. These cohorts are actually, you can see that these cohorts in your one analysis instance. I've set all these cohorts in your each of the instance you will use. So let's go back to your instance. This is the analysis instance you can see. And there are several menus. Let's see the data source. This data source of this analysis is simple 100K. It means that it's synthetic data, which is fabricated data. So it's a virtual data set comprised of the 0.1 million patients. So in the data source, in the dashboard, you can see that how many people are enrolled in this data set and how many males versus female are here, and the ages of this patient group, because this is the simulated patient group mirrored by the Medicare, which is the American insurance for older people, older than 65. So there are many old people in here. This is cumulative observations and the process of a continuous observation by month. If you're gonna go to the condition of person in the data source, you can see the diagnosis table. So once again, the condition means diagnosis in here, and the larger box means that there are many higher prevalence of diagnosis in these patients. So many of them have lipid disorder. It makes sense, and the darker color is that frequency of the disorder. Like if you have a multiple diagnosis for this, it was cardiac disorder, atrial fibrillation. So the darker color means that your frequency was higher than other diseases. So it's kind of another tool to describe your data source automatically. So it's analyzed as kind of a platform to combine many different tools for amoxicillin. This is the district. This is leveraged by Acute, which was the previous data quality measure and data characterizing tools for amoxicillin. And in the core definition section, you can see that the course I've made. So you will make these 4 courses during this tutorial. This is a major of yours. Let's see how it looks like. So this is the course of Ticagrelor, and I set the PCI as an index event. The percutaneous coronary intervention was the index events, and then it should be first time in the person's history, and it should be the adults. And for the additional inclusion criteria, I've said that they should diagnose as a ACS, and they should take the Ticagrelor within 7 days before on the day or before CI. And another criteria include not using Clopidogrel or Prospera, and no previous stroke, no previous dry bleeding. This is the exit criteria of this cohort. The end of the continuous drug exposure when we allow the maximum of 7 days between exposure records. So, in the real world, when we prescribe the drug like 30 days, the patients sometimes does not come up after just right after 30 days. They will continue to take the medication because sometimes they skip the medications in the home. I do not think that if you are a patient, you are prescribed the medications. It's not very easy to take the pills every time. Sometimes they just forgot to take it, and then that's why we allow some time gaps between the events, between the prescriptions. I 70 is a very strict criteria because Ticagrelor is very important drug in the patient with acute coronary syndrome. So I just define persistent window as 7 days. So that's how I define the Ticagrelor group, and we are gonna replicate this. That's the first presentations of mine. We will take a 10 minutes class, and then we will start the second session from 45 or 45. Okay. If you have any questions, please let me know during during the rest time. Thank you.
Question.
Of course.
You may be touching this, but I know that you mentioned microphone, sorry. So I know you mentioned that we don't use exclusion in the atlas, but when I look at the example that you showed for we can't pronounce it, but
Ticagrelor.
Is it because in the inclusion criteria, if you select patients without a condition, that would be an equivalent to an exclusion criteria in a normal clinical trial?
Right, indeed. So, when I said the exclusion criteria such as without Clopidogrel or Clopidogrel, I allow at most zero occurrence of Clopidogrel or at most zero occurrence of Clopidogrel. Sometimes you wanna allow use the elites twice two occurrences of Clopidogrel mandated. Just like so there is no exclusion criteria itself, but you can make the exclusion criteria by not allowing any single events during the time window.
Yeah, it's not that we don't use exclusion criteria.
Right, it's just how you phrase it.
Yeah, it's just how we logically
Right.
program it, right? It just doesn't say exclude X, Y, and Z. It just says includes people with zero of these. Thus, it becomes excluded. So it's not that we don't exclude. We exclude. She can't do these things.
Okay, great. During the rest time, you can feel free to ask me anything, but after just 10 minutes, we can have another session.
Chan is already 40 until 50 then.
Okay, that's great.
Okay.
15.
You guys have 10-minute break. Thank you.
Thanks.
Any questions? I'm here. Please raise your hand. And Chan is also there as well.